My name is Carrie Walker, and I'll be facilitating the Village's Health presentation on sexual health. Please keep in mind that the information contained in this presentation is for educational purposes only and is not intended as a substitute for advice from your healthcare professional. Today, we're going to cover what is a sexually transmitted disease or sexually transmitted infection, abbreviated here on out as STD or STI, the statistics regarding them, what are the most common STDs that you should know about, how can you prevent them, and some other resources. Let's start with what is a sexually transmitted infection. There are millions of new infections occurring every year in the United States. STIs are passed from one person to another through sexual activity, which could include vaginal sex, oral sex, or anal sex. In some cases, it's possible to transmit them just through close physical contact, but typically that's not common. STIs cause mild infection if any symptoms appear at all. This makes it particularly easy to transmit STIs without even being aware of it. It's very important to get tested if you are having sex. You have to consider that if you are having sex with one person, they may have, and you are only with that person. It's possible, however, that that person was with quite a few other people prior to having a relationship. So it's extremely important to feel comfortable having conversations with your partner before you engage in sex. If you are diagnosed with an STI, know that all can be treated with medicine, and some of them can even be cured entirely. The most important consideration is that all STIs are preventable. Let's take a look at the prevalence of STIs. The most common sexually transmitted infections in the U.S. currently are HPV, chlamydia, and gonorrhea. We'll go over each of those more in depth in upcoming slides. STIs have a profound impact on sexual and reproductive health worldwide. More than 1 million STIs are acquired every day. In 2016, the World Health Organization estimated that 376 new infections there were 376 million new infections, with 1 out of 4 of them being STIs, including chlamydia, gonorrhea, syphilis, trichomoniasis. The state of Florida ranked among the top 10 in syphilis category, according to a study in November 2017. Due to the availability of medications available to help with erectile dysfunction in men and pain and dryness in women, more older adults than ever are engaging in sexual activity. Although the rate of infection is highest among people ages 15 to 24, the increase among older adults was larger than the rest of the population. Let's take a look at some of the STIs that are most common. Chlamydia is a common STI that can infect both men and women. A man can spread it to a woman and vice versa. It can cause serious permanent damage to a woman's reproductive system if it's not detected early enough. This can make it difficult or impossible for her to get pregnant later on. Chlamydia can also cause a potentially fatal ectopic pregnancy in younger women. How does it spread? You can get chlamydia by having vaginal, anal, or oral sex with anyone who has been infected with chlamydia. If your sex partner is male, you can still get chlamydia even if he doesn't ejaculate, because the bacteria is transmitted through the contact of the skin and the mucus linings. If you've had chlamydia and were treated in the past, you can also still get it again. So there's not a vaccine that protects against this. You have to treat it each time. You can get infected if you have unprotected sex with somebody who has chlamydia. If you are pregnant, you can also give chlamydia to your baby during childbirth because of the contact with the membranes. One of the most distressing symptoms of chlamydia is that there are no symptoms. So it's very easy to pass it along and not even be aware, thinking that you are being responsible. Chlamydia can take weeks before any symptoms appear, which again makes it very easy to pass along and not even be aware of it. When symptoms do become noticeable in women, they could include an abnormal vaginal discharge or a burning sensation when urinating. Symptoms in men also include a discharge, this time from their penis, also a burning sensation when urinating. Could also include pain and swelling in one or both of the testicles, although this is less common. Men and women can also get infected with chlamydia in their rectum. This happens either by having receptive anal sex or just through the spread from the infected sites, such as the vagina. While these infections, often in the rectal area, cause no symptoms, eventually pain or discharge bleeding may arise if left untreated. Are you at risk? The truth is, anyone who has sex can get chlamydia through unprotected vaginal and/or oral sex. However, sexually active young people are at a higher risk of getting chlamydia because of their behaviors and the more frequent partners. Gay, bisexual, and other men who have sex with men are also at risk since chlamydia can spread through oral and anal sex. The good news is chlamydia can be cured with the right treatment. It's important that you take all of your medication that's prescribed when you receive a diagnosis. Typically, you are asked to take medication up to 7 days. And again, it's important that you completely finish your medication before having active sex again. Otherwise, you are still considered contagious and can spread it. So you can have sex again after you're treated. Again, you want to make sure that you've completely finished your medication. Make sure that your partner has also been treated, even if your partner is not showing symptoms. If you discover that you have chlamydia, you should assume that you have infected your partner and both of you should get treated. Gonorrhea. Again, who gets gonorrhea? Anyone who is sexually active can get it. Gonorrhea can cause very serious complications when not treated, but the good news, it can be cured with the right medication. Gonorrhea is a sexually transmitted infection that can infect both men and women. It causes infections in the genitals, rectum, and throat through oral sex. It's a very common infection, particularly again among the younger people because of their more frequent partners. It is spread by having vaginal, anal, and oral sex with someone who has been infected with it. Again, a pregnant woman with gonorrhea can give the infection to her baby during childbirth because the baby will come into contact with the germs as during the birth process. One of the problems with gonorrhea is that, particularly in men, it's possible that not to show any symptoms at all. However, just because you don't have symptoms does not mean that you're continuing to spread it to other people. If men do have symptoms, they may include a burning sensation when urinating, a white, yellow, or green discharge from the penis, and again, painful or swollen testicles, although this is again less common. Most women with gonorrhea also do not have any symptoms. However, if she does show symptoms, they're usually mild and are often mistaken for a bladder or vaginal infection. Women with gonorrhea are particularly at risk of developing serious complications from the infection, even if they don't have symptoms. Symptoms in women can include the painful or burning sensation with urine when urinating, increased vaginal discharge, and even vaginal bleeding between periods. Who is at risk for gonorrhea? Everyone who is sexually active is eligible to get gonorrhea. A sexually active person can get gonorrhea through unprotected vaginal, anal, or oral sex. The good news, again, is that it can be cured with the right treatment. And also, similar to chlamydia, it's important that you take all of your medication that the doctor prescribes to the very last day, because you can still be considered contagious and pass gonorrhea if you've not completed your medication cycle. Medication for gonorrhea should not be shared with anyone. Although the medication will stop the infection, it will not undo any permanent damage caused by the disease. So it's important to be proactive. If you are treated for gonorrhea, you can have sex again, waiting until you've finished all your medication. Genital herpes. Genital herpes is a sexually transmitted disease caused by two different types of viruses. The viruses called herpes simplex virus type 1 and herpes simplex virus type 2. The link between genital herpes and oral herpes is that the oral herpes can be spread from the mouth to the genitals through through oral sex. This is why some cases of genital herpes are in fact caused by the oral version first. How common is it? It's extremely common. More than 1 out of every 6 people aged 14 to 49 years of age have genital herpes. You can get genital herpes by having vaginal, anal, or oral sex with anyone who has had the disease. If you do not have herpes, you can be infected if you come into contact with the herpes virus in the following ways. Touching a herpes sore on someone else. If your partner has an oral herpes infection, the infection can be spread through direct contact with that sore or through the person's saliva. Skin in the oral area of your partner who has the herpes cold sore can also lead to infection. You can get herpes from your sexual partner who does not have a visible sore or who does not know that he or she has been infected. Again, a lot of the symptoms are undetected. It's also possible to get genital herpes if you receive oral sex from a partner who has oral herpes and again does not know it. Contrary to popular belief, you will not get herpes from toilet seats, bedding, swimming pools, or for touching objects around you such as silverware, soap, or towels. Genital herpes symptoms. Most people who have herpes, again, unfortunately, similar to most STDs, have no symptom or have very mild symptoms. You may not notice the mild symptoms, or you may mistake them for another skin condition such as a pimple or an ingrown hair. Because of this, most people who have herpes do not know it. The sores usually appear as 1 or more blisters on or around the genitals, rectum, or mouth. The blisters break and leave painful sores that may take a week or more to heal. When these symptoms are present, the person is told that they are having an outbreak. The first time someone has an outbreak, they may also have flu-like symptoms such as fever, body aches, or even swollen glands. Subsequent outbreaks typically are not as bad, and they become shorter. Please keep in mind that although you may not have an outbreak, the infection stays in your body for the rest of your life. Can herpes be cured? Unfortunately, when it comes to herpes, there is no cure. However, there are medications that can prevent or shorten the outbreaks. One of these anti-herpes medications can be taken daily, and it makes it less likely that you'll pass the infection to your partner. If you have herpes, it's important to inform your partner and let them know, because there's always a risk. Even if you're not currently engaging in an outbreak, it's possible still to spread the disease and infect your partner. So you want to make sure that they are aware of the risk. Human papillomavirus, HPV, is the most common sexually transmitted infection. It is a different virus than the herpes virus. 79 million Americans, mostly in their late teens and early 20s, are infected with HPV. There are many different types of HPV. Some are more problematic than others because they cause more damage long term. HPV is spread by vaginal, anal, or oral sex with anyone who has the virus. You're starting to probably notice a pattern. STDs or STIs are spread by engaging in sex, whether it's vaginal, anal, or oral, with other people who have been infected. HPV can be passed even when an infected person has no signs or symptoms. Anyone who is sexually active can get HPV even if you've had sex with only one person. You can develop symptoms years after you're having sex with someone who's infected, which makes it difficult to track when the infection was transmitted. And it's also making it difficult to track how many people you might have subsequently infected by not knowing that you had it. HPV is known as the silent killer because some of the variants show up 1 to 2 years later and can damage the cervix, leading to cervical cancer. Although only a small percentage of people infected by HPV will develop cervical cancer, it is certainly worth knowing about. Syphilis is the next STD that we are going to talk about. Syphilis is a sexually transmitted infection that can cause serious health problems if not treated. It is divided into stages: primary, secondary, latent, and tertiary. There are different signs and symptoms associated with each stage, so don't be confused. It again is spread by direct contact with a syphilis sore during vaginal, anal, or oral sex. You find these sores usually located around the penis, vagina, or anus, or in the rectum, on the lips, or inside of the mouth. Again, unfortunately, this is an STD that can spread from an infected mother to her unborn baby as it comes into contact with the sore in the birth process. Symptoms in the primary stage are generally a sore or sores at the original site of infection. These sores usually occur on or around the genitals, around the anus, or in the rectum or the mouth. The sores are usually firm, round, and painless. Symptoms of the secondary syphilis include a skin rash, swollen lymph nodes, and fever. As the disease continues to progress, severe medical problems can arise, and it can affect the heart, brain, or other areas or other organs of the body. Trichomoniasis is a very commonly transmitted sexually transmitted infection. This one is not a bacteria, it's actually transmitted by a protozoan parasite. Although the symptoms of the disease vary, most people who have the parasite, again, cannot tell that they are infected. It's the most common curable STI in the United States. Estimated 3.7 million people will develop the infection. However, only about 30% of those people will have any symptoms at all. Infection is more common in women than men. Due to the structure of our bodies, we have more warm, moist environments in which for these little critters to live. Older women are more likely than younger women to have been infected with it. The parasite passes from an infected person to an uninfected person during sex. In women, the most commonly infected part of the body is the lower genital tract. In men, the most commonly infected body part is the inside of the penis. During sex, the parasite usually spreads from a penis to a vagina, or from a vagina to a penis, or from a vagina to another vagina. So, all that considered, it's very important to be proactive before engaging in sexual activity. The only true way to avoid STIs is not to have sex at all. However, if you are sexually active, you can do the following things to lower your chances of getting an STI. One of which includes being in a long-term mutually monogamous relationship with a partner who has been tested for STIs and has negative STI results. Make sure to use latex condoms the right way every time you have sex. I would suggest if there's even a chance that you might have sex with someone, that you carry a condom with you and be prepared. Because all it takes is one episode of unprotected sex for you to be infected with an STI. Again, remember that although your partner may be monogamous or want to be monogamous with you, prior to you coming on the scene, it's possible that he or she was infected by somebody else and is not even aware of it, particularly if don't appear until much later. Another approach is to talk about the potential risks of STI before you have sex with a new partner. That way you can make informed choices about the level of risk you're comfortable with taking regarding your sex life. If you or anyone or someone you know has questions about any STI, please reach out to a healthcare provider. I wanted to mention when it comes to HPV, it is possible to get a vaccine ahead of time to prevent the likelihood of receiving the virus. So I hope that after hearing this information, pause before engaging in sexual activity with a new partner and take the time to have the conversations to make sure that the both of you are safe. And lastly, if you discover that you are infected by an STI and have been sexually active, please be responsible and communicate that with your partners so that they can themselves get tested and make sure that they are not continuing to pass it on to other people if the two of you are no longer involved. If you have any questions, please consider reaching out to your healthcare provider, or you may contact us for questions at the Villages Health Learning Center. And here are some additional resources that you can research on the web. Thank you for joining us for this Villages Health presentation on sexual health.